In order for HIV transmission to take place, the virus obviously has to be present. It must also be present in a relatively high quantity for infection to occur. Indeed, most transmissions occur when the already infected person is in the early stages of infection, when the quantity of virus in their bloodstream is at its highest. Someone on medication with an undetectable viral load cannot easily pass on HIV. For transmission to occur, an exchange of body fluids must take place. HIV is present in a number of body fluids including blood, precum, vaginal secretions and semen. Blood and semen are the two most commonly exchanged during transmission. It is also present in saliva, urine and tears. However, not in sufficient quantities to be able to cause infection. Therefore, it is virtually impossible to be infected from contact with these fluids. To be clear then, HIV cannot be transmitted by kissing or any form of casual contact. Nor can it be transmitted through intact skin. For HIV to be able to infect someone, it must pass from the site of initial entry. During sex, this is commonly a mucous membrane, such as the vagina or anus, into the bloodstream. Once in the bloodstream, HIV passes from there into the lymphatic system, where it is potentially able to begin infecting the T cells. This is precisely why the sharing of contaminated needles is so dangerous. If there is blood present in a contaminated syringe, the person reusing it is in effect injecting themselves with HIV. It must be pointed out that even if exposure to the virus does occur, it is not certain that a person will become infected. Generally, it takes multiple exposures for a person to become infected, as HIV is a relatively hard virus to transmit. This is no excuse for complacency, though. HIV infection can, and very often does, occur even after a single exposure. Even if a person has been exposed, there are things we can do to prevent infection from occurring. Specifically, the administration of pre-exposure prophylaxis that we detailed earlier.